So I just want to thank you, Toni, for sharing your story because sharing is so important. Many times, patients that I see often think that they're the only ones going through stuff. And it's acknowledging in the space that we're all perfectly imperfect. So I do appreciate that. So as I was listening to you speak, Toni, it made me think about some of the things that, I do to create a safe environment. We are a part of that environment as professionals. And so I thought to myself, what could have made your journey easier, right? When I'm listening to your story, what are things that we as professionals could be doing differently or better? And so those are the things that I thought about in the professional care stance. And so I often wonder, do physicians, other mental health care professionals, how many of us in the professional realm do spiritual inventories to see where people think they fit in in the creation? And those sorts of things are important. And there are many different tools that I'll go into later down the track that we can use to assess these sorts of things. And so one of the things I say to patients, especially patients of color, because the amount of times you'll see a Black psychiatrist, because we only make up 2% of the medical force, so we're like unicorns, it's going to be pretty low. So how do you come prepared for the appointment? And those are the things that I like to highlight in the community, is being prepared. And how do you share your stories in an organized way in a profession where you have less and less time to spend with patients? So those are the thoughts that I had. So one of the things is being able to be as truthful as possible. And I recommend that people come with things written out. So you talked about generalized anxiety. What are the symptoms? How is it impacting your quality of life? And then broadening what we mean by quality of life. Because oftentimes in the Western lens, right, we're thinking about quality of life in that materialistic, immediate way, but broadening that, how is it impacting you spiritually, emotionally, physically, and looking at the entire person? So those are some of the thoughts that I had, but I want to make sure we have time for the other speakers to chime in. But I appreciated your story, but I want people to come prepared. So to me, that's the most important thing, given the fact that our healthcare system has become a business. And so less and less time is devoted to patient care, which is unfortunate. So being prepared as much as possible and bringing support people that you feel safe with, I think is also really, really important.
Wow, thank you.
Well,
I do have a question for Cal. So your work focuses on male trauma recovery, Cal Spears. In your
Yes.
experience, sir, what are some of the unique emotional health challenges men face, particularly in Christian and cultural contexts? And how can we begin breaking those barriers?
Yeah, so I actually grabbed an article specifically from the Association of Medical Professionals. And what it really gets at is, what are we missing? And one of the things you see is that the research is kind of there around, there's two prongs. One is on the provider side. So when we come in and we see a man, we have certain biases that we don't necessarily understand about ourselves, right? In terms of even just how we're enculturated around masculinity and so forth. And then there are things that men come into the room with about themselves, about what it means to be a man, full man. And those sort of competing, dueling forces can impede a man's ability to be able to get help. So, for example, men struggle to differentiate between depression and stress. And a lot of times they will not get help until things get really bad. The American Bible Society in Barna found that typically what happens is people are most open when it's the worst, which means in a church setting, if someone is open, you know it's bad. So for men, a lot of times, this is kind of the tricky thing, right? You got a small window, a very narrow window. And that once that window passes, it's over. So for example, in 2020, during the pandemic, incidences of men reporting mental health went up beyond women. But the year after that, all it took was a year and they subsided. So men will peak out for a moment and then they'll go right back into that little hibernation, that little cave. And so the other thing about a lot of men, I would just say very briefly, is men associate their identity with being able to provide economically. It's just that simple. There's kind of a biological imperative we see in Genesis 3, theologically. You can't take that out of a man's psyche. And so now we're kind of like, after thousands of years, kind of where women are able to earn, which is great and so forth, but men are struggling to sort of find their place in everything. And so what men do is they're more likely to get into the toxic hustle because they identify being able to provide with being a full man. One of the things I would say for men that's very important, let me just say theologically, is this. Men have to relate to Jesus, not just as the Son of God, but as the Son of Man. And specifically in Matthew 11 and 12, come to me, all you're wearing burden, and I will give you rest. The thing he's talking about is what gives us rest is that idea of kingdom rule. So you're never going to find peace without kingdom rule, right? The reign and rule of God exists within a person. However, the Son of Man is something that you can really help men with, because men, again, they really struggle to put down that veneer. Men need to understand that Jesus is the Son of Man. He's not just the Son of God. And so as a result, he doesn't despise our need for rest. I would say for a lot of men, there is a lack of Sabbath on the inside. Trauma is a lack of Sabbath on the inside. So men aren't finding Sabbath. They're not resting, and they don't feel that they can, because it's part of their identity to work. And so helping men find their identity, not just in the work, but also in the rest.
Wow, this is very intriguing. I know this is a time block panel, but I do have one question that relates to what you just said, Mr. Spears, and it's everyone on the call. I mean, the panel. What do you do when you feel guilty, when you want to rest? How do you overcome that feeling? Not having that Sabbath.
You're asking me first and foremost?
The entire panel,
Okay,
but
sorry.
you can speak as a man if you choose to.
I can speak on that. I wear many different hats. Like I have my own practice. I also do, speaking engagements, and there's just a lot of things that I often juggle. And they say that when you switch from a 9 to 5 to a business, you are actually switching to a 24/7. And so I'm constantly thinking about not just my practice, but like my ministry, right? What God has for me. And at times I feel guilty to rest because there's always things on my mind. There's always things that I feel like I should be doing. But then I remind myself about how healthy it is for me to rest, how more effectively God can use me if I rest. And so I manage the guilt by like really reframing my mind about what rest is like. And sometimes like that varies. Like this Friday, I went to a bookstore and I just started reading on self-care for mental health professionals, and that provided rest to me. And so sometimes we think that rest is maybe just kind of sitting out, and maybe that brings guilt, but maybe rest is just creating a variation from your usual routine. And that's how I manage that guilt.
Can I add on
Anyone
to
else on the call?
one thing that I always relates to the idea of rest and giving yourself permission to rest is we have to remember that God rested. Like at the beginning of the Bible, he worked and he rested. He gives us the example of how we should live our life. He's a very simplistic God. He gives us instructions. He gives us the way. So we just have to, again, get in the word and model our lives by it. So if God can rest and he's all being and all knowing, who are we not to rest? We should be following that example.
I have a question also. I want to share an opinion. I came in a bit late, so I heard Dr. Spear, that's his name? Kyle Spear?
Kyle Spears, sorry, yes.
Yeah. So I am in agreement with what you have said. But my focus is that as women, I don't think we are, and I want my sisters to understand when I speak is what I observe. I don't think we are as supportive of our men as how we are to. Because, for example, I will say to my daughters, if you love someone, and we know men, God create men special, as I would say to my students, in the sense that when you think about it, God created man, and then from man, he took woman from his ribs. And women could never come about without that aspect. And God wants us to understand that. And even when he did that in creation, the fact still remains that if we don't get the seed from the man, we cannot continue the whole generation. I think sometimes as women, we are so into getting what we want than how we want to help and support our men. We forget that just as, and I'm going to share something personal. I'm married and actually for near 40 years. And I remember when we have challenges, time, still do, and I go to God, he will show me my fault. Sometimes as women, we see everything that is wrong with our men. And we forget that these are the same qualities that draw us to them. And then when we live with them now, and it's an everyday thing to deal with, we become burdensome. But we forget that we too have flaws. And we always just see the flaws in men. Oh, they do not talk, they do not do this. But what about us? Sometimes I think if we take time to analyze and to understand that as women, we too have our flaws, we too have our moment, and try to meet each other halfway. I don't think I would be in my marriage now if I didn't try to understand my man and to see where he's coming from. He has a lot of flaws, just like me. But I have to understand that, guess what? We all have sinned and come short of the glory of God. And I want women all over the world to know that. Sometimes I believe that men get a hard time from us women. It is okay for us to slap our men and to do things to our men and then be protected. But when we do the same thing and the men retaliate, there's a problem. So we have to start to think. Because for me, what I see is happening in society is like we want to undermine our men, and that is from my opinion. I don't have data to prove it, but from my perspective, this is what I see. And sometimes it hurt my heart because when I see our young boys who are growing up, mostly women are the ones who are grooming them, and we intimidate them. Don't do that, don't do this. How a man to be a man if when he be himself and we are having problem of him being himself and telling him how to be?
Yes,
what it is that we want? What do we want as
yes,
women?
Ma'am. Yes, Miss Brown. Thank you. Thank you so much. I think there's just so many moving parts, right? And I think what you just said is powerful, and I hope it resonates with people accordingly on the call. And what you're saying actually leads me to my next question, because the theme of this symposium is holistic health, right? So how, and this is for you all on the panel, how do you define emotional health, right? Because it's sometimes not explored with a holistic framework that includes mind, body, and spirit. And how do you help clients pursue that that integration in practical ways?
I'll share briefly. So one of the models that I use is internal family systems. So I'm a marriage and family therapist. And what I like to help people understand is that families exist on the outside, but they also exist on the inside. There's an inner child in there. We have different ages. People don't even realize they have different ages. There's times where I do work with people and they'll be disconnected and I'll say, look down at your hands. How old do your hands look? And sometimes people are shocked because they're like, oh my gosh, I feel so young, but my hands are so old. People are disconnected from themselves and within themselves. And so there's a family in there and it needs leadership. And a lot of people have no idea how to create leadership from the inside out. Right. And so that's part of the thing that I do with helping people to work with their inner selves is there's a team in there, and guess what? You're the leader. You're kind of in some ways the person you've been looking for. And that's a shock to people too, right? So just, yeah. And to me, holistic is that we have to really understand that God image in us, that there's a self in there. And most people are disconnected from their selves.
I would like to add that sometimes there's like this either or perspective, whether we either only focus on healing through our faith and God alone, or the other extreme, which is focusing on other secular ways of healing. And I feel like it's so important to combine the two and not isolate one from the other, because both are important. And it is so important to rely on God for support and prayer, and that brings a sense of peace and healing. Yet it's also important to seek help from professionals that God have used and given the skills to help you if you were to have any concerns in your mental health, right? That someone you could listen to. It could be a therapist, it could be a coach, it could be a mentor, but just using a combination of strategies to heal is important.
Okay, let me ask you this. How do you respond to Christian clients who are unsure or even ashamed about seeking therapy because of messages they've heard in faith settings?
Yeah, that's a really good question. So the theme I often see with my Christian clients is often this hesitancy towards therapy due to this belief that God alone can help them overcome their mental health concerns. And there's often like this fear of seeking therapy or seeking help through that means, as if it were to be a lack of faith. And although I wholeheartedly believe that God can help, God can deliver, God can definitely bring, like I said, healing and peace. And God often works through people, including mental health professionals. We, as mental health professionals, can be instruments towards the healing process. So seeking help from a trained and experienced mental health professional is not a lack of faith. So that's how I often explain it to my clients, that it isn't a lack of faith that you're seeking help, rather a step towards your healing and restoration process. And that usually helps a client who's Christian and never sought therapy feel like it's more normalized. And I think it's about how mental health professionals too are framing therapy. You could call it counseling, right? It doesn't have to be called therapy. You could call it counseling, you could call it support, and framing it as a way of like an individual really who maybe is trained in that field to walk you through it and to listen to your concerns without judgment, with empathy, with love, unconditional regard, rather than someone diagnosing you and telling you all the problems that you should fix about yourself. And it's so important to be proactive, like seeking therapy, not just when things are to a point where you can take it anymore, but just when you're noticing the signs that, hey, I may need support. And at times it could help if the therapist is Christian as well, right? But so to answer my question, it really has been about like just how I frame it to my clients and how I incorporate God in how I frame it.
Gotcha.
From
Thank you.
the patient perspective, when it comes to that, when I talk to other people about my mental health journey, I remind them of what I had to remind myself, which is when I have a cold, an ear infection, I sprain an ankle, shoulder, whatever, I don't have a problem calling my mom or my sister or my pastor or whoever and saying, hey, I got to go to the doctor because I have ABC physical health problem, right? So I should not have any kind of stigma about going to seek help because I have a mental health problem. It's the same thing. It's all a part of your health. And so that is the thing that kind of got me over, because when I first started therapy, my mom knew, and that was it.
Wow.
I didn't want anybody else to know because I was ashamed that I was therapy. And when I went on medication, my mom knew and my roommate knew, so that if there was an emergency, they could tell the doctors what I was on. And that was it,
Wow.
because I was ashamed. But
Mm.
if I have to go on any other kind of medication for a physical problem, or if I've got to get a cast because I broke my leg, I'm not ashamed to tell people that. I'm not ashamed that that is what I have to seek. I'm also not saying, oh, I'm just going to pray over this broken leg and not go see a doctor and God's going to heal it. I'm just going to pray about this flu and it's going to go away. I'm going to go to the doctor. I'm going to get medicine. It's the same thing. And so I had to convince myself of that. And when I talk to other people, I kind of share that analogy with them.
Thank you. Yeah, it's a blessing that you had a support group. Everyone doesn't, have that. So this question is for Mr. Spears. It relates to what Miss Toni just said, but something in the chat. How do you gently support and pray for your husband when you can discern these things but don't want to come off as you're being a therapy or you're spiritualizing everything?
Ooh.
A therapist, I should say. I'm sorry, spiritualizing everything.
Yeah. So this is tough, right? Because I truly believe. So Toni, I just want to say, Toni and Brittany, you guys did a great job. I love what you guys shared. I feel very blessed by it. Yeah, it's tough. This is, to me, where, and this is going to sound probably a bit prideful, but I would want my wife, I want my kids to see me as the leader of the home. And this is just our home. So I'm not trying to press anybody, but I am the leader of our home. Spiritually, I'm sort of the covering, so to speak. I take that very seriously. But I also want my kids to see me ask my wife for help. We have a son and a daughter. Okay. I want my son to see his dad ask his wife for help. And I want my daughter to see her mother not constantly give unsolicited advice to her dad. Because there's this partnership. And so what I think, to me, there is a partnership, but there's kind of this idea of how we come off. So I come to versus come at. And so I think approach is 95% of it. And if it's built off of trust, at least for us, that's kind of our little economy, is if I trust you, I lean on you. And to me, I don't want to get into symptom solving, right? Do you guys actually look at one another as a resource?
Yeah.
That's step one, right?
Thank you. Yeah, I think that actually ties into what Ms. Brown, who joined the call, mentioned. Oh, wow. Okay, maybe we can get 2 more questions in, I'm hoping. Okay. So who on the panel hasn't spoke yet? I've heard a little bit from everyone. How about we go to Dr. Enrique? Medications can sometimes be a controversial topic in Christian communities. How do you help individuals understand the role of medication as a part of holistic approach to emotional healing?
That is a good question. So I was thinking about that and praying on it, because it's different for every person. So first and foremost, do I see a full person in front of me, right? So we talked about biases. And so we have to be reflective of our own biases when we're in the room with someone, and be honest with ourselves and be honest with God. And so first and foremost, I have to meet someone where they're at and establish what is important to them and view their strengths. Oftentimes in medicine, we look from a deficit model. What don't you have? What can't you do? Instead of what are the things that you're doing well already? And what are the things that we can support you with? I look as medication as part of the plan, not the full plan. And also, it's important to give people options. All human beings want options, even in emergency situations when someone is psychiatrically unwell. And I've seen some really unwell people in my career. It's still being able to meet them where they're at safely and give them options. So firstly, when I find out that someone's a Christian, is going through a spiritual inventory. Where does that fit in their life? Have they had a positive experience, a negative experience with that? Because we can't make the assumption that everything was, you know, rainbows and glitter. You actually need to figure out what is going on for that person. And then do they have a community? And how do they see their spirituality as part of their treatment? So before I even get to medication, I need to assess other things first.
Wow.
So I very rarely in my career go straight to medication unless it's an emergency. Someone is that unwell. I go step by step. So that's really important. And especially because a bulk of my career was working with children. So I very rarely jump straight to a prescription pad. We need to assess other things first. So when we get to the point where medication is going to be valuable, it's explaining what are the options and then how does that fit into their lifestyle. So one of the things I want to know is what sort of support system someone has, because some of our medications have a lot of side effects. So those sorts of things are really important to me. And then I remind people that God is one of our greatest scientists. He gives us this knowledge. So before scientists even came into being, God is our greatest scientist. He is our greatest healer and doctor. So I use that as a model and step by step, incorporating God. And that's if it's important to that person, because we also have to remember that church religion has been traumatic for some individuals. So I have to piece that together as well. So I do really think it's important to meet people where they're at in their faith journey and then incorporate, but also emphasis on the fact that medication is just part of the plan. So it is not the full plan. It's not the be all end all. As the other panelists have discussed, you need to do some hard work, and that we are here to do it collectively. And so that's what I do when I see patients. And then I remind them that psychiatry is the medical study of the soul. So I am actually invested to get to know who you are as a person. So I will leave it at that because I know we are pressed for time. But
yes, we are. But I wish I could clone you because I just feel like you do your due diligence, and a lot of people see therapy as an avenue to capitalism and medication. So the fact that you feel you do your just due diligence and see science as an art, science as an art, it's just very warming to hear. But thank you. I do want to switch over to Brittany, because again, your poem was very relatable. And you shared a biblical foundation for emotional health. So how do you balance encouraging spiritual practices like prayer with also emphasizing the importance of therapy and other emotional tools?
Yes, so I appreciate the question, and thank you to Katie and Toni, because you all hit a lot of points that I was thinking of in regards to acknowledging that God gives all of us gifts. So in the same way that he gives doctors gifts, these are our natural powers in order to move in the space of therapy. The only thing that I would add to that is that you don't wait till you feel better to go to the doctor. You either go in a crisis situation or you're doing your checkups. And so I relate that to the same way in mental health. If you have a crisis situation, focus in on your mental health and also do checkups. And I'm a huge advocate of doing those checkups and check-ins every day throughout the day. You have to breathe. You have to take those moments of silence. You have to pause, because then all of these energies and stretching, like how I said earlier, all of these energies, they stored in you, and that dis-ease turn into disease. And all of the chronic illnesses that we are seeing, there's studies out there that shows that almost 90% of it is stemmed from either trauma and or stress. So we can get to the root of these things, and we can stop the manifestation in some capacity. Also, I will say that we can do better integrating instead of separating. So I believe it was Rachel talked about adjusting to and both versus or. That's a huge thing. So really just focusing on, we can do both. We don't have to separate it, and creating spaces like this naturalizes it. If you look at the grand scheme of the mental health, We have to be real about the history of it, and there has been a lot of unfair and unjust practices, experiments, especially with people of color. So we have to address that disadvantage that we have into moving people towards trusting mental health. So really acknowledging that and bringing it into the space of Christianity really will help subside some of those things. And I will also say partnership. I believe it was Kyle that talked about partnership in the household, and I appreciate everyone who has been transparent about the roles in the household, because I'm creating a family now. I just had my child, so it's new dynamics. We're learning as we go. So I appreciate the people that have that experience and the wisdom that you shared. And I believe that same partnership, God wants that from us first before we even can move it to the partners that's in our home, before we can even move it to the spaces of our children. We have to keep that partnership with God, and He will give you what to do. He will tell you, call this person. He will tell you, seek therapy. He will tell you, eat this type of food. He will tell you to drink water. He will tell you to rest. Again, we just have to be silent enough and intentional enough to create that constant communication and line of affection with God so we can hear Him clearly. And the last thing I would say is acknowledging the practices that are in the Bible that accentuates wellness. So prayer and meditation, we know this isn't a word. This is the same thing when it comes to mental health, rest, expressing gratitude, expressing praise, physical wellness. God tells us to honor our bodies as temples. So whether that's moving, being intentional with our eating habits, whatever those are, is a correlation between the two in almost every way that we can always pinpoint. Confession and forgiveness, getting out that illness that's inside of you, either from a situation with yourself or someone else. Community and fellowship, again, mental health. And then creating that wise counsel and mentorship, and that can look like therapy. The Bible says that with wise counsel, we able to truly flourish. So that is something that we can implement in mental health as well. So
I love that you said that. Go ahead.
Yeah.
I'm sorry.
Yeah, absolutely. So those are ways that we can truly just move in a space of alignment, in a space of just getting the best out of this life, because we wake up with so much ambition, but God is just like, hey, whatever you want to do, I am the answer to that. So just listening to God's voice, and He will be able to help us in our mental health journey.
Thank you. Thank you. So some keywords that resonated with me was energy, and alignment. A lot of times some of these terms overlap in different conversations and different walks of religious, paths. And then sometimes we just kind of lead people to that higher power, and